Hi, good morning, everyone. My name is Kathy Liu. I'm an assistant professor at the Public Management and Policy at the Andrew Yang School, but soon to be associate professor. So I just got the announcement on Monday. So welcome to the third of a series of urban conversations hosted by the Council for the Progress of Cities. So today is the third one, and we're going to discuss various issues surrounding immigrants in cities. So we have assembled a panel of scholars from different units on campus. So let me first introduce, I think I also have a slide right here, to introduce the panel that's with us today. So first we have Charlotte Alexander from both the business school and the law school. Then we have Holly Wilking, who's with the Department of Communications, and we have Charlie Jarrett, who's with the Department of Sociology. So our game plan today is that each of us have a few slides that we want to kind of share with you and share with you kind of the type of things that we're working on around immigrant issues, as well as kind of the research questions or the research directions that we are pursuing. And we will have plenty of questions, plenty of time, which we would hope to take your questions and that will engage in a real conversation. And also, yeah, I think that's it. Okay. So for me, from my end, I will first talk about some of the context. We'll talk about kind of employment, as well as entrepreneurship. Charlotte will talk about some of the legal rights issues of immigrant workers. Holly will talk about health communication in immigrant communities, and Charlie will be talk about some of the political aspect of immigrant groups. Okay, so that is me. So I think since I'm the first one to talk, I might well start with some of the context so that we kind of start with some big pictures on immigration issues and why it is an important issue in the United States. So here, this chart gives us some just very general trends of the share of the foreign-born population in the United States from 1860 to 2010. So we can see that in terms of share-wise, we're not, which is this gold line right here, we're not kind of at the highest level in history, but in terms of the volume of immigrants, which is the blue line, we're at a very high level. So now immigrants make up about 13% of the total population in the United States. That is about 1 in every 7 workers or residents, or it's actually 1 in every 6 workers. So it's have a higher share in the labor force as compared to kind of the total population.
Legal and illegal, or just
Yes, this is the total. This is the total, yes. We also understand that the composition of immigrants have changed over time. So this is just the snapshots of 2 periods. One is 1970, one is 2007. We can see that the sending countries of immigrants have changed. In 1970, we have 62% of the immigrants coming from Europe, whereas now, as you can see, that percentage has changed or actually decreased to 13%, versus Asian population from 9% to 27%. And people from Mexico and other Latin American countries combined, it was 19% in 1970. They make up more than 50% now in 2007. Okay, it's similar with kind of the people from Africa, from 1% to 4%. So even though in terms of the total share, it's not all that different from probably 100 years ago, but we can see that the actual makeup or composition of immigrant groups have actually changed quite a bit, and that really have a lot of implications when it comes to when we talk about employment, education, political participation, and a lot of the issues. So today our discussion is immigrants in cities. So immigration used to be an urban phenomenon. I say used to be because in the earlier time, immigrants tend to just start and settle in urban areas, in metropolitan areas. But now we understand that immigrants do actually play a role in agriculture in rural areas in the United States as well. So this map actually shows just kind of the general distribution of the immigrant population by state in the US, and this is 2010. Okay, so we can see that they still concentrate in several of these large immigrant states, so California, Arizona, New York, New Jersey area, Florida, as well as kind of Texas, Illinois. So they have, the highest of these. This is over 30% of the state population are immigrants. I put another layer there, which is kind of the shaded area, which are areas have more than 35 of the foreign-born population actually arrived after 2000. Okay, so that is a different thing from just looking at kind of the total foreign-born population, because it means that these shaded areas start to receive a lot of immigrants ever since 2000. You can see that Georgia or Atlanta is actually one of these states, and with the foreign-born population, over 30% of them arriving after year 2000. So what we call kind of the emerging gateways. So again, just very quickly, when we say this is an urban phenomenon, and some of the studies actually very nicely categorize these cities into different kind of types of immigrant gateways. Okay, so I think this is helpful in our context because some of the panelists are going to, quite some of us are going to talk about Atlanta. I know Holly is going to talk about Los Angeles. This is helpful for us to understand that these cities and their role and their immigration history are very different. So for example, Los Angeles is one of these continuous gateways, whereas Atlanta is one, what they call kind of the emerging gateways. Okay, so this is just some kind of a context of this bigger question of immigrants in cities that we're talking about. So some of the, again, this is, I guess, the last one of that context. This is Atlanta, showing you where the immigrant population are in Atlanta metropolitan area. So the central city right here, this is by census tracts. We see a lot of concentration kind of along 285 in that area, so we know it's Gwinnett area, and then we do also have other settlement here in Cobb County, around the airport area, and elsewhere. The highest of these concentrations of these census tracts or neighborhoods have over 50% of the population who are immigrants. I want to just talk very briefly on some of the research questions that I've been working on or still plan to work on. One is this question is that how are immigrants' residential location, how have immigrants' residential location shifted over time? And that both means kind of across the different metropolitan area as well as within metropolitan areas in terms of from the central city to the suburban areas, and how does that residential location change their job accessibility in relation to the location of employment and jobs. So I've looked at a series of issues on spatial mismatch between kind of the immigrant population and jobs, and kind of how that will shape their earnings, their employment outcomes, and their commuting over time. And the second set of questions is really has to do with immigrants' employment outcomes, and kind of this policy debate on how they're competing with the type of jobs that native-born workers are actually working on. Especially, I think a large part of that discussion is between the low-skilled Latino immigrants and the low-skilled minority workers, especially Black workers, and how that kind of dynamics have been both within cities as well as across different cities. And the last stream of research that I've been working on, and I think I'll continue to work on for some time, is immigrant entrepreneurship. Because a lot of times when we talk about immigrants, we talk about them as workers, ignoring the fact that they could also be business owners, setting up businesses, also hire other workers, and have an impact on the communities. So I don't think, because today I think we're providing very kind of general overviews of our work, so I wouldn't have the time to talk about these topics in detail. I think what I will do is that I will share a few slides, 1 or 2 slides of charts and tables of each one of them, just to get these topics started, and we can talk more about it if you actually have an interest. So this is showing you kind of the residential location of the immigrant population in between the central cities and the suburban areas, and compare that to the share of jobs in the metropolitan areas. So on the x-axis, we have kind of the change in the share of immigrant population in the suburban areas. On the y-axis, we have the change in the share of jobs in suburban areas. So this really shows us, this is 1980 to 1990, this is 1990 to 2000, how those two kind of changes actually correlate with each other over time. So for the foreign-born population, immigrant population, as compared to the native-born population, we see kind of a faster suburbanization trend over time. I mean, part of it has to do with the fact that immigrants might be more concentrated in the central cities to begin with. So over the last 20, 30 years, they have been suburbanizing at a greater rate. Okay, so this is something that some research is documenting these days, is that they have become more dispersed over time. And the second question, I did a study on Atlanta's low-skilled labor market, especially kind of the low-skilled labor market in comparing the Latino immigrants with the Black workers. So it's very, I think, striking to me, at least, to note how kind of the growth of the Latino immigrants population in this segment of the labor market. You can see that this is 1990, 2000, 2008. Back in 1990, Latino immigrants only make up 3% of the low-skilled workers in Atlanta. But in 2008, they now make 42%. Okay, and if you look at those numbers, they also kind of grow a lot. So now they outnumber the Black workers in the low-skilled labor market. So versus for the Black workers, their actual size, even though the percentage-wise it remained fairly consistent, shrunk quite a bit, but in terms of total numbers, you can see kind of this decreasing trend over time. Yes.
Does this represent replacement in the market, or blacks moving out of the market upward or downward, or?
This is the total market.
I'm sorry?
This is the total low-skilled labor market, the total numbers.
Does it represent replacement, or does it represent something different going on with African American workers who are either moving up or perhaps leaving the workforce?
Right, that's a very good question. So continuing with this inquiry, I also look at kind of the occupations that they actually work in. So looking between 1990, 2000, 2008, what are the top kind of what they call the niches or occupations that Latino immigrant workers and Black workers actually concentrating in Atlanta. Now, I didn't show that slide right there, but I have very detailed statistics in the paper. Latino immigrants concentrate, if we count the top 10 occupations that they work in, that would be 60% of Latino immigrants. So kind of they are really concentrated in a small number of niches, and the same way for Black workers, that they're concentrated in about 10 different occupations that make up about kind of 50% of Black workers. And if I trace those occupations over time, which is kind of become really interesting over the 20 years, is that you do not see a lot of convergence in these occupations. In other words, you see more kind of a divergence in the type of jobs that Latino immigrants do versus the type of jobs that the Black workers do. And that divergence actually has been increasing over time rather than kind of converging over time. So for example, things like construction laborers, things like the food prepare workers, things like the cooks. You know, you see more that the Latino immigrants are taking some of these niches, back in 1990 that the black workers actually working in. Okay, so this is kind of like a summary, which shows the dissimilarity index between the niches that the Latino workers working and the black workers working. So you see that, I'm not going to go into the details of the dissimilarity index, but basically the smaller the number, it shows that they're more similar. Okay, the spectrum of occupations they're working are more similar. If you see a bigger number, it shows that the spectrum of occupations that they actually working are more different. Okay, so you can see that in 1990, if we look at the occupations of black workers in 1990 versus the Latino workers in 1990, the dissimilarity index is 51. Okay, which means that 51% of either group need to be moved for them to achieve an equal spectrum. Okay, so this is a 51%. But in 2008, you can see that this is black workers 2008, Latino workers 2008. We're looking at a dissimilarity index of 61, meaning that 61% of the workers in either group need to change job for them to achieve an equal distribution. Okay, so meaning that the actual occupational distribution of these two groups have become more different over time. Okay, so in more detailed analysis, you do see that Latino immigrants are taking over some of the jobs that black workers are doing. But that seems to be, because following that, I did an earnings analysis. It looks like it's that the Latino immigrant workers are kind of pushing up the black workers along the job ladder in terms of, even though it's still low-skill job, but the jobs that the black workers are working on actually tend to have higher pay, higher hourly pay. And if you look at the specific occupations, so Latino immigrants are taking more of these manual kind of labor-intensive jobs versus the black workers in this low-skill segment are taking more language-intensive jobs. So like retail, administrative kind of office jobs, so which will use more of the English language skills. So it's very interesting. If you look at it over time, it does seem like there is it seems like a little bit of a crowding out between these two groups, but you see more kind of a pushing up of between these two groups. And it doesn't seem like there's a downward pressure on wages. This is kind of the message from that paper. But again, the paper is already published, so there are a lot of data there if you're interested. So lastly, I want to talk a little bit about this idea of immigrant entrepreneurship. If you look at kind of the self-employment rate or business formation rate, the immigrant group and the native-born group, they have a very similar self-employment rate, which is around 11.5%. In other words, about 11.5% of both groups tend to be self-employed. So in kind of looking at the various issues around this general topic, there are two ways to approach it. One is to look at the firm-based data. In that, the one source that's very interesting is from the survey of business owners. That's part of the economic census hosted by the Census Bureau. So which looks at kind of all the different firms, also distinguishing between Asian-owned firms, Black-owned firms, female-owned firms, Latino-owned firms. The other way of looking at it is to look at population-based decennial census or American Community Survey, and to use the self-employment of the individuals as a proxy for their business formation. So I actually did this to just compare these two data sources and to see if there's kind of a lot of variations, but it seems like they produce very similar and consistent results. At least this is for Atlanta. So you can see that this is all firms in Atlanta in 1992, Asian-owned firms, Hispanic-owned firms. So this is 6,000, 4,000. In 2007, this is all the different firms in Atlanta, but then Asian-owned firms grew to 35,000. Hispanic-owned firms grew to 25,000. Okay. If you look at the population-based data, some would vary because now we can, just looking at immigrants, right? Asian immigrants, Latino immigrants, all self-employment, this number kind of matched this number very, very well. And if you look at the Asian immigrants, self-employed Asian immigrants match this number fairly well as well. Okay, and going to 2008, This is using the 2008 ACS. The total numbers of self-employed match the total firms. And more or less, right, there's still some variations. Self-employed Asian immigrants versus the Asian-owned firms, self-employed Latino immigrants versus Hispanic-owned firms. Because these Hispanic-owned, Asian-owned, they doesn't differentiate between whether you are immigrants or the native-born population. So you see these numbers are actually somewhat higher than these numbers right there. Okay, so both of these, I think, would be valuable data sources for the inquiry on immigrant entrepreneurship. How are we doing on time? Okay, yeah, this is the last slide. So, so again, several things that I've been working on. One is that what are their role of these immigrant-owned businesses in communities, right? So where are they located? Are they really filling the niches that when we say we have food desert, or we have some areas without a lot of grocery access, are they filling in the niches in those areas? Are they filling in areas that doesn't have a lot of retail or businesses? And what are some of the impact they have in these communities? A different track of research that I was working on is immigrant entrepreneurship in high tech and innovation, especially their contribution in some of the high tech startups. These are what people call the high tech, high growth firms, where they actually have a much higher share in that group of businesses as compared to kind of the traditional mom and pop shops that we traditional kind of have, or the stereotype for the immigrant businesses. And lastly, kind of what is their role in the global economy in terms of, we did a very preliminary analysis seeing that immigrant-owned businesses actually have a higher propensity to engage in transnational activities. And that is to say, having outsourced in other countries, or having exports, or have other kind of linkages with other countries. So this is an area I don't think that has been explored a lot. The SBO data gives some information on it that I think we'll keep working on for some time. So this is just a very general overview of some of the issues around immigrant employment. Now we have Charlotte to go over some legal issues.
Right, so in some ways my little heading here is a little bit misleading, because I'm interested in the legal rights of immigrant workers, but the step beyond that is which groups of workers actually take action to enforce their rights, and what influence immigration status has on workers' ability and willingness to take action to become enforcers of their rights, specifically in the workplace. So that's the focus of my few slides here. So as a general matter, what drives workplace claiming behavior? And by claiming behavior, I mean the sort of transformation of somebody's gripe or problem that they have in the workplace into a legal claim. So who makes claims, who stays silent, and why? So there I'm interested in the influence of the demographics of workers, and, for example, immigration status, and also the job characteristics of the job they hold, what industry. And the reason this is important, taking a step back, is we have in our country what I call a system of bottom-up workplace law enforcement. And by bottom-up, I mean that workers themselves have to take action to enforce the labor and employment laws that we have, and I'll show you what I mean here. So if we look at civil rights employment cases over from 1997 to 2011, there is a federal agency, the EEOC, that is empowered to bring workplace claims on behalf of workers, but its activity is dwarfed by cases filed by private plaintiffs claiming that they were discriminated against on the job. So there is an ability for what I call top-down enforcement, where government comes in and enforces anti-discrimination law, but really the bulk of the enforcement work is done by workers themselves. Same with the Fair Labor Standards Act, which is the wage and hour federal statute that provides the minimum wage guarantee and overtime. We see there is an ability for the Department of Labor to enforce those laws, the Department, US DOL here, but private plaintiffs really, again, do most of the enforcement work. And then even when we look at those cases that are actually brought by the Department of Labor itself, we see that the way those cases initiate, or the way that investigatory and enforcement activity starts, is by and large as a result of complaints. So 75% of Department of Labor wage and hour investigations were complaint initiated, as opposed to 25%, which were initiated on the basis of the department's own strategic enforcement priorities. Yes?
So if you go back a slide,
Yes.
the private plaintiffs, what proportion of those are coming through an organization as opposed to an actual individual with an attorney? Like, are they coming through
Sort of a nonprofit.
or are they coming through a nonprofit that makes its living by promoting this kind of case?
So I have other research underway that's actually looking at that very question with respect to Fair Labor Standards Act cases. I don't know the answer yet, but I think anecdotally that the answer is a very small percentage. So most of these folks here are represented by a private attorney, or maybe some are pro se, bringing the case themselves, just the plaintiff. But a relatively small, I would say not very many, are actually being represented by, let's say, a nonprofit legal services entity or a union. Most of them are represented by private firms. So these slides are to illustrate this idea that workers are doing the bulk of the work enforcing their rights on the job. And so then my next question is, well, what do workers need to be able to actually become enforcers of their own rights? This is a woman who is showing her paycheck that actually wasn't signed. She was a plaintiff in a wage and hour lawsuit. So workers need legal knowledge, right? They need to know the substance of their legal rights, and they need to know something about the procedure of enforcing their legal rights. So what do you do if you think that your rights have been violated? And then they have to have the right incentives. So they have to feel that if they want to keep their job, they're not going to immediately get fired if they sue their employer. They have to have some sense that the benefits of suing are going to outweigh the costs. If you remember, I'm interested in, so which categories of workers have legal knowledge, for which categories do the incentives line up in a way that produces rights enforcement? And so I'll just spend a few minutes talking about some analysis I did of a survey that was conducted by another a consortium of advocacy groups and academics back in 2008. They surveyed about 4,300 low-wage frontline workers in 3 cities. They released their own report, and then it's covered up here, but last year they released their data to outside researchers. And so the workers who were surveyed were defined as frontline low-wage workers, and so that meant that they worked in an industry where the median wage was less than 85% of the median city wage for New York, LA, and Chicago. That actually worked out to about $8.27 an hour that they were making. Frontline, so they weren't supervisors, managers, or technical workers. And sort of connecting up with what Kathy's research focuses on, they fell into these occupation categories. So these are the folks doing the work kind of at the bottom of the labor market. A majority were Latino Hispanic. About evenly split among U.S. citizens and undocumented workers. There were very small numbers of folks who were foreign-born citizens or legal permanent residents. Vast majority were non-union. Most worked for small employers defined by those who have fewer than 100 employees, and about an even split male-female. So what I was interested in are these questions about who is perceiving problems on the job, and then how are those problems being advanced into legal claims. And so what this is illustrating is about a third of the respondents to the survey perceived a problem. The remaining folks reported they didn't have any problems at work, and this is the previous 3 years prior to the survey. Now, we actually calculated, there was raw wage and hour data in this survey, and we were able to calculate how many folks actually had a problem, at least looking at their wages. And about 76% had not been paid properly and lawfully. So if we're looking at the real incidence of problems, at least with respect to wages, we have a real sort of under-perception or under-counting problem because we only had a pretty small group here perceiving that there was a problem on the job. Now, problem here was very broadly defined, any sort of problem on the job. It could have been a wage problem that someone was reporting that actually violated a law, or they could have reported this 33% also counted people who had, gripes about their supervisor that maybe did not violate any law. So then we looked at of the people who perceived a problem, who actually made some sort of claim, and by claim here we define that as contacting a lawyer, contacting an outside advocacy group, actually going all the way through with filing a lawsuit, or making some complaint to a government agency. So this was kind of a range of both internal and external, informal and formal claims. And we saw that 43%, the largest chunk here, made no claim even though they had identified a problem. 37% made a claim about a problem that was justiciable. So this is a problem that actually is a violation of the law. And I should say these are actually claims, so not necessarily people here that we're counting, which claims or which problems became claims. And then of the people who actually made a claim about a justiciable problem, a problem that was a violation of the law, then we looked at how the employers responded. So the largest percentage here represents inaction, so no positive or negative response by employers, although I suppose you could count that as negative. And then there were 15% and 28% retaliated in some way, so retaliation that actually broke the law, or other forms of retaliation, maybe treating someone negatively in a way that didn't actually rise to a level of being illegal. So we saw here this sort of drop-off, right? So first of all, there was a drop-off between, at least just looking at wage problems, we saw a drop-off between actual incidents of problems and people who were able to identify those problems, and then drop off with respect to transforming that problem identification into some sort of claim, and then we see pretty discouraging responses by employers. So then the question, that we're interested in today about, well, how does immigration play into all of this? Well, so we're still working on this, so this is preliminary, but we looked at a variety of demographic and job characteristics to try to figure out which groups of workers were more and less likely to identify problems, make claims, experience retaliation, and then we also were interested in these legal knowledge questions. Now, so far, the only place immigration status has popped up as being significant is that folks who didn't have legal immigration status were less likely to have procedural legal knowledge, meaning less likely to know which government agency or is there to help, or which or how to actually activate whatever legal rights they have. And we can theorize about that. Perhaps if you don't have legal immigration status, if you're undocumented, a lot of work has shown that those folks fear contact with government, with the state apparatus. So it makes sense that they might have less legal knowledge about how to actually activate their rights under the law. But we've had some other sort of preliminary findings. If you're not a union member, you are less likely to identify problems and make claims. And I won't spend a lot of time on this due to our time limitations. But we're seeing generally that as workers' sort of power and stability in the workplace declines, it seems that they're less likely to kind of have those tools, those prerequisites for actually enforcing their workplace rights. And so as we think about conditions of work, and particularly conditions of work in industries and in occupations that primarily employ immigrant workers, I think it's important to consider the role of immigrants as rights enforcers, right? It's not just sort of broad economic forces that set wages and working conditions, but it's also the ability of workers to step up and enforce their rights. So as I was just saying, we have this sort of over-deterrence of workers to become enforcers of their rights, under-deterrence of employers, and this ability to enforce, we see, we're starting to flesh out that analysis, but appears to be distributed unevenly among workers. I believe that's it for me. Pass it on.
You had a question.
Oh, a question, I'm sorry.
I was just wondering about the role of, the potential role of some workers being paid cash and it not getting reported, so cash under the table. Both in terms of whether or not what you're thinking looks like a problem, isn't a problem because they know they're getting paid but you're not seeing it. And also whether that becomes they get sort of put into a trap that they can't then report.
Right, so if they report, then they would implicate themselves as well. Yeah, so that could be something going on here, and we have some survey responses. There's some questions about the method of payment, and we could definitely look at that. And I think, so that larger question with respect to undocumented workers comes up all the time, because if you're undocumented, then if you report some sort of violation of labor and employment law on the job, aren't you implicating yourself there? So it's the same, the cash payment question, I think, raises some of the same issues. And, then there's a question about enforcement priorities. So if the IRS, if a worker is concerned about having been paid in cash, and therefore is silenced and prevented from reporting other violations of the law, then don't we need to think about maybe, IRS enforcement priorities, just like we think about ICE enforcement priorities. Maybe ICE is not supposed to intervene when there's a labor dispute, for example, and we could think about a similar kind of policy setting for the IRS or other entities that would be implicated with the cash payment situation. So, yeah, I think that could have a silencing effect, but perhaps could be addressed or solved by thinking about who is enforcing the different areas of law. Were there other questions? Okay, I'll pass it to Holly. There. I just held it. Do you want to hold it?
All right, so switching topics slightly, the project that I'm going to talk about is one that I'm associated with at the University of Southern California, the Metamorphosis Project. It actually started in the late 90s to kind of address the question that Putnam had put out there of whether or not civic society was dead in big urban environments. And so the initial project was looking at different ethnic communities in Los Angeles and looking at civic engagement type of factors and what influences civic engagement. When I was asked to join the project in 2002, the project had shifted slightly to also addressing issues of health, recognizing that both there was funding agencies interested in this question, but also that this was an issue of interest to the different ethnic communities that they've been working with for the first couple of years. And there's a close association between health and political participation. So the big, broad question that I came on with is how do we best reach these different groups with health information and with health messages? The problem that one of our funding organizations had at the time was that they were running this big health insurance program where they were trying to get children insured, and they had money and they had health insurance to give them, but the immigrant communities in Los Angeles were not signing their kids up for this program. And so they were trying to figure out, how do we reach them? How do we actually get this information to them that they are eligible and that they should be enrolling their children? And so I came on with that as kind of my big, broad question. The theoretical kind of background of the study is using the communication infrastructure theory. So we premise that basically, like you have an economic infrastructure and you have a political infrastructure, that each community also has a communication infrastructure. And in terms of the communication infrastructure, you have two main parts to it. The neighborhood storytelling network, which are going to be those different
communication sources on different levels that are telling stories about your neighborhood. So you have the residents themselves, their families, and their social networks, and who they're talking to about the neighborhood. You have the local and or ethnic media. In a lot of these areas, they're going to the ethnic media for their area instead of local and mainstream media in the United States. And also those community organizations that are serving those communities. And the initial research was showing that when you have these three different groups interacting with each other and telling stories about the neighborhood, then you are more likely to see those civic engagement outcomes, that people are more likely to feel and act like they belong to a community. They were more likely to come out. So a few years ago, we had all these immigration rallies in Los Angeles. They had 500,000 people estimated to come downtown and march with their families. You had people in the Los Angeles Times calling our project and other projects going, oh my gosh, how did this happen? Because the mainstream media were clueless. But all of these different community level organizers were all heavily involved in getting all those people organized and getting them involved. Now, the ability for the the neighborhood storytelling network to work and for people to engage with those storytellers is both enabled and constrained by different factors in the communication environment. So let's say you work a job that takes you outside of your community and you have to work multiple jobs, then you have less chances to come in contact with those community organizations or with the other residents in your community. Work constraints could also work in different ways. I did a separate project with someone in Singapore where the migrant workers there have work constraints where they're kept from actually connecting during the daytime hours that the work organizations that would help them or available to them are actually open. Then you also have the things like public spaces that can bring people together, but if you're afraid to go to the parks in your area or you have unsafe sidewalks, things like that, that also affect public health, affect whether or not you're going to engage with the different people in your neighborhoods. So given the fact that we'd found that these different storytellers were actually able to connect people to increase their levels of civic participation, and we know that civic participation is often related to better health information recall and better engagement with health knowledge or willingness to receive health knowledge, we look to see if this particular configuration integrating to the storytelling network would actually lead people to having greater health knowledge. In this case, we found that there was a relationship between integrating yourself into the storytelling network and having greater breast cancer knowledge as well as diabetes knowledge amongst Latinos. In my dissertation project, I actually found that there was an association between the integrated storytelling network and perceived ease of receiving medical care. The interesting thing about that one is in the last couple of years, a colleague and I have followed this up and looked at the same types of variables with African Americans and Latinos living in a different community in Los Angeles and found the opposite to be true, that integrating into the storytelling network actually led to more negative perceptions. And that's why actually knowing what's going on in the storytelling network at the time is important, because at the time, the communities were fighting to keep the King Drew Trauma Center open in their community, and it was not looking so good. And it actually did end up closing. And so just because the stories are out there doesn't mean that it automatically leads to positive outcomes. If the stories are not good, not necessarily leading to positive outcomes. Same thing with exercise. We found that the more integrated into this storytelling network, we did find a positive outcome there for exercise, increased exercise. Along with the now conflicting finding that we found with the healthcare access, we also found that there was no association at all between connecting to the storytelling network and prostate cancer knowledge. The basic premise we have there is, how can you expect the storytelling network to improve health outcomes if they're not telling stories about that particular topic? prostate cancer tends to be something that's taboo amongst all ethnic groups, but in this case, particularly amongst Latinos, they're not talking about it. Therefore, their media are not talking about it, and their community organizations are not talking about it. And Kathy mentioned earlier food deserts, and so the data that we collected that this no relationship was found between the Storytelling Network and the intake of fresh fruits and vegetables was in a community that is known to be a food desert, and therefore you don't have them available. So what we're now turning our interest to is, okay, how do you turn the Storytelling Network to telling these stories about things like prostate cancer that might be taboo in a community, or to engaging the community to try to solve some of these neighborhood problems, like the fact that you don't have fresh fruits and vegetables. So a lot of times in health communication, people are like, oh yeah, we just created this campaign and said, eat more fruits and vegetables, and it's brilliant. But if they're not there for you to actually eat and to purchase, then the campaign has kind of failed. And so you need to figure out how to solve that problem before getting the Storytelling Network to actually encourage eating them. We need to actually encourage the importance of them and building the community gardens and things like that. The other thing that I've taken away from this initial research is, okay, it's great that the Storytelling Network is benefiting people who are connecting to the Storytelling Network, but what about the people who are not connecting to those storytellers? That because of work constraints or because of other factors in the communication action context or the communication environment, they're not connecting to these storytellers. How do we reach those people? And that's really what the initial organization that funded us was basically asking us to do of, okay, we've been going through the community organizations in these areas and they're not helping us. So what are we doing wrong? How do we find these people? So what we've started to do is move to this idea of looking at communication ecologies. And that is to, instead of just focus on these particular storytellers that we do know have positive health outcomes, look for the rest of the people, what communication channels are they connecting to? And we found some interesting things initially when trying to figure out what are the top sources of communication that you're going to find out information about your community. And so I'm going to give you just a couple of examples. So in Glendale, these are some of the communities that were the early communities that we were looking at on the project. In Glendale, we looked at Anglos who reported primarily going to the mainstream newspapers, also some interpersonal channels, mainstream television, and internet. The Armenians, because it is the largest population of Armenians outside of Armenia in the United States, we have here mainstream television being their number one place to find information about their community. Geoethnic television was also tied with that, so that means locally based or for their particular ethnic community. And then also they were going to interpersonal channels as well as mainstream newspapers. While the Latinos that were living in the same community also reported mainstream television and Spanish language television and mainstream newspapers as well as interpersonal. So when you're looking at this, if you were doing a community organization in Glendale trying to reach these different groups, you see that there's not one source that you can go to and put all your money there, sign up for your health insurance, through this particular channel, because the different people are going through different channels. So you're going to have to target not just because they're different ethnic groups, but because they're going to different sources. But that's where it also gets a little bit interesting with Latinos living in Los Angeles. So again, I have this for many more communities than this, but if you just compare Latinos that were living in Glendale to the groups that we had living in Pico Union, you see that for Pico Union, almost half of them are going to Spanish language television for their community news, as compared to only about 1/3 in Glendale. Then primarily you have 1/3 of them going to interpersonal channels. You have mainstream television, much lower, and also the geoethnic newspapers, so the Spanish language newspapers that are in those communities also being something that pops up. So even if you had this strategy of, okay, we need to find all the new Latino immigrants and reach out to them, let's just make friends with the people over at Telemundo. My project had figured out that Telemundo, even though Univision was the larger network, Telemundo had a local station that was more willing to work with researchers and people in the local community. It wouldn't necessarily reach all of Latinos, so you have to segment further and try to figure that out. Now, with my initial project where I said healthcare access, we found perceived ease being related to having been connected to the integrated storytelling network. What I found there is the people that did not have good access to healthcare, they said that they were primarily finding information through the Spanish language television and through interpersonal channels. So we have both worked with promotoras, which are different interpersonal groups, health workers that go from the community, that go and work within the community, but also that's why we've been trying to work with some of the Spanish language television out there, is because they're the ones that were having the most health access issues. This idea of building this communication ecology, we've now taken a step further. So instead of looking at community-wide, what people are saying were their most important storytellers, is we've tried to take it further and try to figure out, okay, for you yourself, how do you go about solving your health issues? And so it's really how you construct your network of sources that you go to for information. And we're hoping to kind of build this into figuring out the best strategies to reach people that are suffering from different health problems. So an example would be that you have two different Latina mothers. This data has been, they've been collecting with Latinas specifically, primarily new immigrant, low income, that through health centers is where they've been meeting them and interviewing them. One goes first to her sister, then her mom, then she chooses a home remedy. That's something that was not coming up when we were asking it in the survey the other way. And then the internet, and then to the doctor. The other one starts with a neighbor, maybe her family's not in town, and then she goes over the counter, then to magazines. That's something that also wasn't popping up, home remedies, and then clinics. And so knowing this, we're hoping that we can merge all this into figuring out how to have better targeted strategies and have people spending their money a little bit more effectively and getting their messages out. The other thing that we've started to do is think, okay, within that community, within that infrastructure, if we're not getting people through these traditional neighborhood storytellers, where are the meeting and greeting places that they're located within the communities? I've done this with African Americans here in Atlanta, but in Los Angeles, they've also worked with promotoras who within one of the Boyle Heights area actually put together something, or they put together, the project put together for them, after they had different meetings where they identified the areas in their community where they'd be comfortable talking about cervical cancer, because again, that's a taboo topic, and they wanted to figure out, okay, if Latinas are not learning about this, what are places in our communities that we can actually go and sit down and have conversations, and women will be comfortable enough to have these kind of private conversations about their health with us in these areas. So they've put together basically maps of places, communication assets essentially. And there's a bigger map of Los Angeles because they've been trying to do this throughout different communities in Los Angeles right now. That's where I think I'll leave it for now, and we'll move on to Charlie Jarrett, who's talking. Yes.
Actually, two questions. On the communication ecology data, one was, is it broken down by age at all, and are there any different trends?
Okay. I've been wanting to break it down by age for a while, and we've never actually broken it down by age. The same thing by gender, and the problem with trying to break it down by socioeconomic status is that the community is already kind of broken down that way. So we've been meaning to also do similar maps by age, and it gets into the how large of an N do we have of different categories, and are we going to then do it across the whole city, even though we don't have data for across the whole city, or by community, by age. So I think that's the reason we haven't actually broken it down that way yet.
The other question I have is, when you have communications via social media, is that counted as interpersonal, or is that counted as via the internet?
Okay, so that's actually a very interesting question, and that's where this new way of measuring the ecology is going to capture that, because the way that we were originally just asking was, you know, where are the places you go, what are the top 2 sources you go to, and so, you know, if they said internet, we don't know, are they going to the internet because of social media, or are they going to the internet because they're connecting to, like, the National Cancer Institute and looking up stuff on their websites. And so that's part of the reason that we've switched the way that we're actually asking the questions and trying to get the data, because we weren't able to capture that previously. Now, initially in Pico Union, one of the differences between Pico Union and Glendale is that you did have different countries of origins for the Latinos that were living in those different communities. And the ones that were living in Pico Union were much less likely to be connecting to the internet in any location. So when asked, so at the time, I'm presuming because there's been a lot of projects that have been in there with mobile phone type of projects and things like that, that the numbers have increased of accessing through your mobile phones. But at the time when asked the question, there was only about 25% of the people in Pico Union saying that they were connecting to the internet versus like 80% in Glendale. So that's part of the reason you're seeing differences between those two areas as well. In Pico Union, primarily newer immigrants from Mexico or from Central American countries, versus Glendale had a much wider variety. You had people from Cuba, from Puerto Rico, from the Dominican Republic, so you got some of the islands as well as Central America, and so there was much more diversity, and I think part of it is when people come and settle, especially with Mexicans, they're settling with different people from their hometowns in the same communities. And so Glendale is apparently attracting people that are not necessarily coming from those same towns that are collecting in those other areas. And so you're seeing differences. There's hometown associations that send money back to their home countries that work in some of these different communities in Los Angeles. And in Glendale, I think the diversity comes from, moving into that community, the rents are a little bit higher than some of the areas, and you know that you're going to have a mixture of neighbors that are from different ethnic backgrounds versus about 96% of the people in the other community were Latino. So I think that all plays into how quickly spread some of the technologies have been in the areas as well. Yeah.
Do you know what is tell you about some separate issues, but I can't stay for the last 30 minutes of the
I don't remember if I brought any with me, but I can definitely write something down for you.
Okay, thank you.
Any other questions? I'll hand it over then to Charlie. And I apparently already,
Which one makes you go forward?
that one does. But I think that was what I didn't figure out. Is that middle point? That just, yeah, I tried it at one point and it didn't work, so I went, okay.
Oh, wait a minute, that's not it. There we go. Good morning. My job is to nudge the discussion a little bit towards the civic and political arena. I'll be talking about what we're calling potential immigrant voters. And potential immigrant voters is an ambiguous concept, so let me clarify what that exactly means. It can mean at least three different things. If there was an election next week or within a month, the potential voters would probably be those immigrants who are registered to vote, okay? A much broader way of looking at the pool of eligible voters, I guess in the long run, would be all immigrants who have legal permanent resident status, okay? And I'm choosing neither of those. I'm choosing an intermediate category. Those immigrants who are naturalized U.S. citizens. So what we'll be talking about are those who are naturalized, if you're familiar with that process, and may or may not be yet registered, but they certainly have the legal right to register to vote. Okay, so that clarifies that. I've been interested in immigrants in metropolitan Atlanta for a long time, but it wasn't until the mayoral election of 2009 that my curiosity was really perked about the political involvement or participation of immigrants. If you remember back to that election, it was a highly contested. In fact, it was probably the closest mayor election ever it eventuated in a runoff election between Kasim Reed and Mary Norwood. And the margin of victory was less than 1%. When the recount was done, it was a matter of 600 or 700 votes is all it took between the winner and the loser of that election. And what perked my interest is that in an election that close, where every vote, in a sense, counts, you would expect, given the reputation of Atlanta as an international city with lots of new immigrants, as Kathy showed, the rising number of immigrants coming and settling, you would expect that the candidates would seek out the immigrant vote. And yet, as I looked at the unfolding election, I didn't see that. Immigration issues were not among those that were being discussed. Crime was a very hot issue, as were a number of other things, including the financial situation of the city. But there was no appeal, really, not much outreach to either connect with or mobilize the so-called immigrant vote. And that made me wonder, is the immigrant vote, first of all, is there an immigrant vote that's at all relevant in the city of Atlanta? And if it's not, where is it relevant? Maybe it's in the suburbs. Okay. So what we'll be looking at first is where really are the naturalized immigrants in metropolitan Atlanta? Are they in the city or elsewhere? Then we'll look, then we'll look at who they are, what nationality or what major categories, geographic categories of the world they're coming from. And then if there's time, we'll sort of extend that and get into discussions that are of some of the questions listed there below. So let's look first at the chart that I've got showing the where issue. Okay, this makes it very, very clear, I hope. I've rank ordered the 5 major categories of the closest counties to the city of Atlanta by the number of naturalized citizens. It's this naturalized citizen column that I'm talking about as the potential vote. Here you see the number of foreign-born in each location, the naturalized, and then we'll talk in a minute about the other two. To make a long story short, the city of Atlanta, you can see, is at the bottom with the smallest number of total foreign-born residents and a surprisingly small number of those foreign-born who have actually completed the naturalization process, less than 10,000, okay? In contrast, Gwinnett has almost double the number of total born of some of the 2 larger counties, DeKalb and Cobb. They're about double the number of naturalized citizens. So the potential voters seem to be up in suburban counties, especially Gwinnett. Okay. Another point to emphasize is the rate at which these communities differ in their, so the naturalization rate, a demographer might say that it's not a pure rate, and it isn't, but what this column represents is the percentage of the total foreign-born population that has gone through the naturalization process. So this is your numerator, this is your denominator, and you can see that for the most part, the other counties other than City of Atlanta have well over 30%, well over a third, almost 40% of the foreign-born are naturalized citizens. Atlanta really lags, less than 30%. In terms of the nation, Georgia and these counties are a little bit lower. The national figure for the percentage naturalized is about 44%. There are some states where the naturalization percentage is over 50% of the foreign-born. So that's one of the questions that we may want to discuss is why is the naturalization rate in Georgia where it stands compared to other places. Now, the other thing that's relevant when you talk about immigrant participation in politics is this column here. What this one is telling us is of either the city or the county's population 18 and over, in other words, that's the age at which you're allowed to begin to vote. Of the percentage that's over 18, how many of them or what percentage of them are naturalized? And you can see, again, is it, being too blunt to say that the immigrant vote in the city of Atlanta is almost irrelevant. Less than 3% is naturalized, and an even smaller percent of that is registered to vote. The only city or county where there's a percentage above 10%, again, is Gwinnett. So that seems to be, the place where the immigrant vote, the so-called immigrant vote, is most relevant. Yeah. So let's move to the next one to see the who question. Who are these people who are naturalized foreign-born? Okay, overflow of numbers. So let's make essentially 3 or 4 basic points here. The first one, okay, despite what is in the media about the importance of the Latino immigrant block of voters out there, it's not exactly what you get here. The foreign-born, the naturalized population, and I've ranked these from the highest in descending order. So the largest block of potential immigrant voters in the 5-county area and these other 3 that I put on the table are the naturalized Asian foreign-born. 82,000 in the 5-county area, and you can see in the other counties as well, but they have a substantial lead. In fact, they're more than double these. If you added up the numbers of foreign-born Latinos, that would be those from South America, Mexico, and Central America, and some from the Caribbean. All those together still wouldn't be as large as the block of naturalized Asian foreign-born are. So I guess that's my main point here, is that despite their lack of attention in the media, the largest potential pool of voters in metropolitan Atlanta are the foreign-born Asian immigrants. No single group has a majority, of course, so what you have is a situation of a plurality. Okay. Second point is that unlike the other states in the Southeast, except for Florida, okay, Georgia and the metro Atlanta area has a sizable and fairly active Caribbean foreign-born naturalized population. They rank number 2, and I think that's a bit of a surprise to most people. They would not have thought that there was that large percentage of them. Another thing about the naturalized Caribbean population that's quite interesting and marks Atlanta as different from the rest of the United States is the rate, okay? They have the highest rate of naturalization. Higher than the Asian, higher than the European, okay? And that's unlike the rest of the United States. In the rest of the United States, if we add another column here for the total US, the Caribbean naturalization rate is a good 4 or 5 points lower than it is in Atlanta, okay? Third, okay, is the other category. Now in Atlanta, the other category is dominated by immigrants from Africa, okay? And the others in that category are Canadians and people from the Oceania, the Pacific, okay? So it's quite a mixed bag. The third thing I want to emphasize is, I guess, the small percentage of naturalized Mexicans, okay? In the one of the slides that Kathy showed, looking at the total Mexican population, from that single country, in terms of numbers of foreign-born, they outnumber Asians or any other category, okay? But question?
Charlie, for Atlanta, are you talking still about the city of Atlanta, or are these the 5 counties?
This is the 5-county column.
All right.
Because the city of Atlanta was so small, I didn't even put it in this chart because
So really, this is Metro Atlanta or?
this is the 5-county metro area.
Right, yeah.
Okay, with selected counties. As you can see, the Mexican vote, potential voters is really negligible. And what also jumps out at you is the low percentage of Mexicans who have gone through the naturalization process, in contrast to some of the others where it's, close to 60% among the Caribbeans, approximately 50% for the Asians, and several of the others. The Mexicans are in at, in some cases less than double digits, 9%, 10, 5, and 13%. So there's something definitely going on with the low percentage of naturalization in Mexico, among the Mexicans. In the rest of the country, it's actually better, unlike it's sort of the reverse of the situation with the Caribbeans. Atlanta, the Caribbean population has a higher naturalization rate than the rest of the country. Among Mexicans, the Metro Atlanta population has a lower naturalization rate than the rest of the country by a substantial amount. So I think that the only other observation I would make is that of all the counties, DeKalb is the one that you can see has the most balance among the 3 major groups. So unlike Gwinnett County, where by far and away, you have over 40% of all of this total, 40% of all of the Gwinnett County naturalized people are Asian. In DeKalb, it's really 3 almost equal sized blocks, namely the Asians, the Caribbeans, and the so-called others. That should probably make, looking down the road to the future, I think that will make for some very interesting potential campaigns and whatnot. So to sum up maybe and get some other discussion going, is there a monolithic immigrant vote? And if so, is it Latino? Well, it should be obvious. What do you think? No. And yet sometimes it just makes me shake my head when it makes me shake my head when a Washington Post columnist writes an open letter to John Boehner and includes the following: "Your party is getting wiped out with the immigrant vote. You lost the Senate because an astounding 90% of the Latino vote in Nevada went to Harry Reid, 86% of it in California went to Barbara Boxer, and 81% for Michael Bennet in Colorado." Okay? Well, first of all, he's confusing the Latino vote with the immigrant vote. Not all Latinos are immigrants. In fact, a very high percentage are not immigrants. So obviously, it's wrong to think of even though the media portrays the immigrant vote as, with a Latino face. If anything, in Georgia, it has more of an Asian face. And yet even that I don't want to create a further misconception. Keep in mind the Asian voting bloc that's naturalized is broken up into many different nationalities, some of which are very, very different in terms of their political interests and participation levels and concerns. So I don't think it's right to treat the immigrant population, especially the voting population, as a homogeneous whole that's going to swing one way, e.g. Democrats or Republicans. We can also talk about things that may affect the naturalization rates of different groups, and even whether or not there are immigrant elected officials in the Georgia Assembly or other parts of the state. But we'll open it up for general questions, I think. Yeah.
I had a question, Charlie. So my thought in looking at the naturalization rate for Mexican-born Mexican-born people was that where's the starting point, right? Because if you start undocumented, then the pathway to naturalization is non-existent, essentially. So so have you looked at, and admittedly, getting good numbers on numbers of undocumented people is very difficult. But I wondered if you've added that layer as well, not just looking at foreign-born as the starting point, but foreign-born in a status with a pathway to naturalization, so sort of the potential naturalized.
Yeah, that's the next step. The data that I'm using doesn't show that. It's from the American Community Survey.
Yeah.
Okay? But when people do start talking about why one group has a higher rate of naturalization than the other, one of the first things that comes into the discussion is, well, what percent of the foreign-born from this country or that country are here without legal permission? Okay. Another, concern is what percentage who are here legally have the right visa status, specifically legal permanent resident. If one nationality has a high percentage of people here on temporary work visas, or a huge percentage are students, that's going to inevitably lower that group's rate of naturalization, because those who are not eligible show up in the denominator but not in the numerator. But there are other factors as well. Yes?
Sort of on this point, I find the word rate a little bit confusing in this discussion, because what you showed us was a ratio.
It's a percentage.
It's a ratio, it's a percentage, but when I hear rate, I think of time coming in, a rate of naturalization. So in other words, for example, if the Caribbeans are all, or a large proportion of the Caribbeans are in their 60s, and a large proportion of the Mexicans are in their 20s, that might explain part of it, right? The Caribbeans have had a chance.
Yeah, another.
So are you able to control for age somehow?
Well, not so much age. It's the way to work it.
Or time
and I did this in an article was demographic technique known as standardization. Basically, what you do is you look at the cohort, the immigration cohort that people come in. So, for instance, in the way the data is set up is, it would be they have it broken down by those who came in since 2000. Then another number is listed who came in between 1990 and 1999, who came in between, let's say, 1980 and 1989. And what you find is that within each of those cohorts, the further back you go, the higher the percentage that is naturalized. Okay? So what you have to do is sort of adjust each group's population, so in a sense, to create a hypothetical. You have so that you're adjusting the actual to see, okay, given the differences in, you're sort of saying, if they had the same population composition in those different cohorts, but had their existing rates of naturalization, then you can make a fair comparison of them. So yeah, I've done that, and it basically, what it does is it accounts for some of the difference between the lowest groups, because groups like the ones I showed here, the Central Americans, the Mexicans, and to some extent the South Americans, are loaded up in the most recent cohorts. And so they haven't had as much time to pass through the naturalization process. But the difference, it doesn't explain away all the difference.
Have you thought of kind of going a little bit, or I guess more specific as far as the spatial distribution of immigration population, especially in Gwinnett County, kind of in municipalities, but also kind of in census tracts? I think it'd be interesting to see kind of the naturalization rate there, but also kind of how empowering their votes can be in a smaller location.
Yes, I haven't done it. I'd be, and what you're saying makes a lot of sense. I'd be interested in doing that with maybe one modification. Given the tendency for politicians in the General Assembly to gerrymander, I don't know that the census tract would be the best spatial area. What I'd really like to do is use the congressional districts or other voting districts to see how the distribution of naturalized voters or even registered voters, to see how they're split up into different congressional districts, because In fact, the immigrant who does represent a portion of Gwinnett County, his district is not even close to being majority immigrant. Most even in the U.S. Congress, most immigrant politicians who are elected to Congress are in districts that are primarily non-immigrant. Yeah.
I may have missed this, but did you find that there's a high rate of the naturalized Asians in Gwinnett, for example, registered to vote, or is there a gap between those who are eligible to vote and actually registered to vote?
Well, I'm relying on some other reports because I haven't looked at the voter registration, but what I've read is that it's sort of it's consistent with the naturalization rates, that of the people who are naturalized, the Mexicans have a lower percentage of being registered. The Asians have a higher percentage of being registered.
And how are you defining the Asian category? Are people from India part of that category or not?
Yes.
Okay.
Mm-hmm. Maybe there's some. Yeah.
I'm going to jump off of his question to make a comment. You started by talking about the Atlanta mayoral race. One of the trends that's going to further make this discussion more interesting, especially in Gwinnett, Fulton, and DeKalb counties, is the creation of all these new little towns. Mm-hmm. And I don't know, I'm curious as to how we start looking at how different potential immigrant votes, like you say, play into politics at the local level. Mm-hmm. This is a personal prejudice because I drove in from Dunwoody, which has been a city since 2008, and I can tell you that there is an immigrant population in Dunwoody, but if you look at the city's politics, you would have no idea.
Right, Dunwoody, no, but check out the new Peachtree Corners is going to be a wonderful, place to see that playing out, and also Johns Creek, high Asian population up there that is fairly active and well organized.
How do we do that data-wise? What is because you talked about getting the data by congressional district, but now we have town boundaries being regional.
Yeah, that I'm just sort of dipping my toe in it. For most of my career, I've been interested in other aspects of immigration, so I haven't even worked out the data sources in a firm way. Maybe I can collaborate with a political scientist who has more insight into that. Yes?
I guess I'm just piggybacking off what you said, because you were all naming very recent incorporations of cities, and it's been, especially in DeKalb County, it's been a big tactic to kind of incubate themselves. The rhetoric, I guess, that they use is to have control of the taxes, but also it's protection and to kind of incubate yourself from around the county areas particularly that are probably more diverse. So I think the politics of kind of creating that space and where they're creating the space is particularly interesting. I think that would be interesting as well. But and I had a question about the congressional district. How large are those districts? I actually don't know a lot about them.
Yeah. They're supposed to be roughly, equal in population size, and some of them cross over county lines. So it's not unusual for someone to have, represent a portion of Cherokee and a smidgen of Cobb, for instance. And but I haven't looked at that closely enough yet. Tim.
Charlie, based on the two presentations, Los Angeles and Atlanta, I wonder about the utility of using Latino and using Asian, because there's such incredible differentiation within those two categories. And so if we begin looking here in Atlanta at DeKalb County, or no, Gwinnett County, we need to differentiate with the Asian, with Indian and Korean and Chinese, huge differences within those communities. And to call them all Asian, I just wonder if we're really getting a sense of, what the political issues are. And in Los Angeles, clearly Pico Union and Glendale, there are huge differences in those communities, both class and, country of origin.
Yeah, there are definitely differences, and that's one of the things that I know would be ideal to, and that's when I get to the, health communication side of things of, it's not just reach, but then the tailoring of the messages, that you do have to be very careful in how you tailor messages to people of different countries of origin, because they're not going to necessarily relate to the same types of messages. And too often in health communication, when you look at the national level, they do separate things, and they'll have an African American one, which there's this diabetes one I use in my class fact sheet that was for African Americans that is so horribly stereotyped and all kinds of stuff and offensive throughout it, that one of the national organizations did. But there is that concept of they just do this, they have an Asian one for a lot of these things as well, and they don't differentiate between the groups. A lot of that ends up having to do with budget, but if you are going to kind of have this overarching concept, you still need to be able to figure out, okay, how do we appeal to everybody? And you're not going to appeal to everybody. And I've had people in my classes here that say, I'm Colombian and I get offended because there's different things that'll use Cinco de Mayo and that has nothing to do with us. Or that they're Brazilian and the language isn't necessarily even right for them, but I'm supposed to be looking at this health message thinking, oh, that's for me, and that's targeted for me. And so there is that aspect that goes after the, okay, how do we better reach people in these different things? How do we better tailor the messages? And at that level, you definitely do have to start segmenting as well based on country of origin.
Yeah, it's a tough balancing act because in politics, numbers matter. And so if you're applying for a grant, if you're trying to invite a political official to come to a meeting, you want to tell them that your organization represents as large a swath of the population, and that's when these broader categories come into play. The CPACs, the Center for Pan-Asian Social Services, when they have a rally, they don't simply say, well, today rally is for just the Vietnamese to come out. They want to fill the streets and make an impact, and numbers matter. And so there's the trade-off that they organize and mobilize around the label of Asian or Pan-Asian and try to, at least for that day, paper over some of the differences in politics between the various groups. But those differences are very real.
Well, I think we have a lot of great discussions, and I think Sally's provided us with a sampler of the different kind of the thoughts and theories or research that are going on campus on this general immigration-related issue. But I know there's still a lot of questions and potential conversations. I think that's the whole point of this conversation, is to get those conversations started. And unfortunately, it's already 11:30, which is the, I guess, the ending time of our session. And we actually have a sign-up sheet. I don't know what will come out of this, but hopefully if we have more kind of conversation going, if we have more of these kind of similar panels, and if you're interested, Charlotte actually has made up a sign-up sheet to put down your information, your email, and we'll let you know what's going on.